everyone. This is Dr. Ameya Udyawar. I'm a consultant cardiologist at PD Hinduja Hospital in Mumbai. And what I plan to do is currently discuss about aspects about prevention of heart attacks and vascular disease. Now, tomorrow being the World Heart Day, I think today is the appropriate time where we emphasize the importance of healthy lifestyle and ways of prevention of heart attacks. Now coming to my first slide, we all know heart disease is important and it today happens to be the #1 cause of death in our country. In fact, in the Western world, it is leading in the number of deaths, not only sudden deaths but also in the slow deaths which happen. And even in India, because of the increasing chances of having or prevalence of having diabetes, blood pressure, and higher cholesterols, and the way the lifestyle is going from bad to worse is causing more and more heart attacks and more heart diseases. Before we start with heart attack, a lot of times people confuse heart attack with a stroke. So just a small difference there. When we say a stroke is basically less blood supply to the brain, and that causes what is called like a paralytic attack. So in majority of the cases, you will see patients complain of weakness of either their upper limb or the lower limb or the limbs. While a heart attack is caused because of similar episode, but here the blood flow is caused or blocked blood flow to the heart. So when you have blockage either in the brain arteries or a blockage either in the arteries, it means that there's something wrong with your vascular system. So not necessarily that you can have disease of the heart or the disease of the brain. Some patients can have less blood supply to their kidneys, which can cause renal failure. Some patients can have decreased blood supply to their upper extremity or the lower extremity, which can cause what is called as a vascular disease or gangrene of the limbs. So these are all manifestations of vascular disease. So when you consider a stroke or a heart attack or any vascular disease, most of the risk factors happen to be the same. So what happens is, this is the cut section of the artery where you see on your screen. As you age or as you grow, there is a small tear in the artery which normally happens in day-to-day in everybody. However, some patients who are prone to develop heart problems, there is deposition of this cholesterol into the arteries. And as you age, normally this cholesterol deposition gets harder and harder and grows by obstructing these arteries. So what happens when you develop blockage? All of a sudden this cholesterol gets ruptured or causes a rupture in the artery and causes a blood clot, which you see here. This is the blood clot, and thereby it suddenly obstructs the artery. This sudden obstruction is basically what is causing the problem. So sudden obstruction in the brain causes the ischemic stroke, and sudden obstruction in the heart causes a less blood supply to that much part of the brain, and that's why it causes a heart attack. Now, what are the factors which increase the risk of the heart attack? Now, there are plenty of factors. Some of them are in our control, some of them are not in our control. For example, age we cannot control, sex we cannot control, the race. If you are born as an Indian, you cannot control that. If there's a very strong family history in your parents or relatives of heart attacks or malignancies, you cannot control that. But there are definitely a lot of things which you can control. Now, some of these things which you can control and thereby reduce our risk of developing heart attack is smoking, alcohol, poor diet, obesity, physical inactivity, and high sugar, cholesterol, and blood pressure. So what percentage of heart attacks do you think is preventable? When you go into the normal thing, majority of the people think that heart attack hona hai to hona hai, but that is not true. In fact, 80% of all heart attack diseases can be prevented, and they can be prevented by extremely simple measures. Now see, this is a picture of people going via the elevator in the mall, but you hardly see anybody taking the stairs. And this I happen to see even in our hospital, where lot of our staff take elevators even for climbing 1 floor. Now, extremely simple. So there are very simple ways to get a healthy heart or a healthy brain or healthy blood vessels. Number one is know the silent killers. Okay, now the silent killers, we all know there are illnesses which manifest very, very silently. You may not know them in the initial stages, you may not detect them, but over a long period of time, they damage your heart, your blood vessels, your cholesterol, all those, your brain. So what are those three main illnesses which are called as the silent killers? One is the cholesterol. So one should know how much is your cholesterol. One should know how much is your blood pressure. One should know how much is your blood sugar. So these are the three main illnesses: diabetes, blood pressure, and cholesterol. So everybody, each and every one of us should be aware of these values, how much we have. Maintain a healthy weight, stay physically active, manage your stress, do not smoke, do not drink alcohol excessively, and eat healthy. I will just cover in brief about each of them. First is know your cholesterol. For example, if you have a cholesterol which is more than 200, that is definitely not good. So if you have diabetes, if you have any heart problems, if you have strokes, if you have any heart illnesses, it is better to keep your cholesterol under control. Now when it comes to cholesterol, there are two main things which you need to know. One is the LDL cholesterol and one is the HDL cholesterol. LDL cholesterol is the bad cholesterol, while HDL cholesterol is the good. So in the different types of fat, there are some things called as cholesterol, triglyceride, trans fats, but here what I would like to concentrate upon is the LDL cholesterol. So when you do a lipid profile, see how much is your LDL cholesterol. Higher the LDL cholesterol is the chance of heart attacks, lower the HDL cholesterol, which is called as the good cholesterol. So you want good cholesterol being more. So how do you decrease the LDL cholesterol? Three basic things: exercise, control your diet, and there are some very good medications like statins. In fact, if you have a LDL cholesterol, if you have diabetes, if you have had a heart attack, if you had a stroke, if you had a kidney problem, in all these patients, your LDL cholesterol should be less than 100. So if you don't have that, you need to be on a drug called as a statin. So how can you reduce fat? First thing is avoid fried food. So if you want to eat anything fried like batata vada, samosas, or anything fried like chiuda, farsan, avoid it. It's best to, if you want to eat fried food, see to it that it's shallow fried on a pan and not deep fried in kadai. Watch for hidden fats in a lot of your curries. For example, coconut curries have a very high incidence of fat because coconut is nothing but oil. So naturally you need to avoid that. Avoid red meat. So if you are a meat eater, avoid red meat. If you are eating chicken, get the skin removed and eat it. Try ways of cooking by which you don't have to fry them, or you can either bake, roast, broil, grill, or even poach the food. Okay, and keep your oil intake very minimum, to in fact 1 teaspoon at a meal time. 1 teaspoon at a meal time. There is something called as trans fats. Now again, trans fats are also very bad for the heart, and they can cause heart problems. If you go into any sweet thing which you buy off the shelf, like cookies, crackers, cakes, chips, donuts, margarine, these all contain trans fats. They are extremely high in cholesterol, and that's why they should avoid it at all costs. So limit the intake of trans fats, cookies, goods, anything sweet, to very bare minimum. Coming to the oils, which are the oils which can be good? In fact, vegetable oils are good. Animal oil or animal fat is bad. So when it comes to anything which is derived from the animal is bad. For example, butter and other types of oil. But if it is vegetable oil like olive oil, canola oil, sunflower oil, these are good. So one would recommend the use of vegetable oils during food intake. Other thing is there is something called as omega-3 fatty acids. Again, this is a type of oil which is there in the fish. So here, in fact, the American Heart Association recommends eating fish at least twice a week because it contains very high levels of omega-3 fatty acids. In fact, omega-3 fatty acids are good for the heart. So it is recommended for most of the patients. Coming to your blood pressure, see to it that you regularly, at least once a month, you measure your blood pressure. Keep it below 130 by 90 or at least 120 by 80. Okay. Fasting blood sugar should be at least in the range of 120 less. If it is less than 100, it's very good. At least see to it that it is less than 126. Again, how can you reduce your blood sugar? Exercise definitely reduces blood pressure. Weight loss, reducing the weight also reduces your pressure. Reducing the salt intake, and if you are a hypertensive, take medications lifelong. Majority of the illnesses like diabetes, blood pressure, and cholesterol use medications to be lifelong. So if your physician has prescribed you medicines, do not stop them on your own. Okay, one very good way of blood pressure is by reducing sodium intake or the salt intake. Normally, the salt intake which is recommended is less than half a teaspoon in a whole day. That is the normal amount of salt which we recommend. In fact, all the vegetables contain a lot of salt. So if you are eating a vegetable, in fact, there is no need to add a salt in those food items. The second is maintain a healthy weight. Now, a lot of people say that I eat very less and still I have not been able to lose weight. Now, that's a very common query. Majority of the patients, they say that we eat less, मैं तो इतना ही खाती हूँ, मैं तो इतना ही खाती हूँ. In fact, I don't take food during the full day. I just have a dinner at night. Now, that's an extremely bad thing. Like, in fact, if you reduce weight, your blood pressure comes down, cholesterol comes down, blood sugars come down, and the risk of diabetes also reduces. So one of the easy ways of reducing weight is you have to spend more calories and eat less calories. So whatever you intake, if it's more than whatever you spend, naturally you are going to put on weight. And that's why it is basically striking the balance. So there is no magic bullet. If somebody tells you, there is this Ayurvedic medicine or that, pill, or there is some this vibrator belt and they are going to reduce your weight, don't believe that. It's not going to work. So there is no magic bullet. You need to work a bit hard to reduce your weight. First thing is always eat a very good breakfast, because if you don't eat breakfast, you're not going to lose weight. So always before you leave for your job or office or your school, see to it that you have a good healthy breakfast. Keep your meal times regular. So eat small frequent meals. Instead of having 2 times good meals like a lunch and a dinner, split it into at least 5 to 6 meals in a day, and see to it that you eat healthy food like a salad or sandwich or fruits or veggies. Eat plenty of vegetables. You eat even 6 to 7 times fruits and vegetables, it doesn't matter. It's a very, very good way of losing weight. However, avoid oily food, avoid fried food, avoid milk products which are, in fact, whole milk, which is extremely high in calories. Avoid sweets. So basically, you choose your food objects intelligently. So see to it that you eat healthy stuff. And again, coming to meat, avoid red meat. Fish is okay as long as it is steamed. So the important thing is keep it simple. Eat a healthy breakfast so that you feel full during the day. Do not fast. Fasting throughout the day is not going to help, because what happens is at the end of the day, when you are fasting for the whole day, you are so hungry at the end of the day that you eat more than what you normally eat during the day. So fasting is not going to help. The second is staying physically active. Of course, majority of them, of my patients, they say that I don't get time, whole day I'm working, I leave the house at 4, I come back at, 9:30, 10 at night, and there's no time to exercise. But then you ask them how much is the amount of TV you watch, everybody says that I watch it at least for 1 hour. So one of the easy ways to exercise is earn your TV time. So what you do is, if you have exercise for half an hour, you get to watch TV for half an hour. That's extremely good, recommended by the Mayo Clinic. So you have to earn your TV time. So in fact, reduce your TV time. If you have exercise for 15 minutes, you get TV time for 15 minutes. So one of the easiest ways is to switch off your TV and go to exercise. It's not necessary that you have to exercise for 1 hour every day, but even 15 minutes of exercising during your job, during your lunch break, even walking in your office, climbing stairs near your house, or just going for a small walk of 15 minutes also, and having 10 to 15 minutes in a day, almost 4 to 5 times, in fact also helps. Now, which is the best exercise for the heart, or preventing heart attacks, or preventing stroke? People say yogas, I do yoga, I do pranayam. Let us be very clear, yogas and pranayams are exercises for relaxing. Basically, they are static postures. So if you are sitting in a particular posture in a particular way, or doing mild breathing, it is nothing but you are relaxing yourself, relaxing your muscles. It's like a stretching exercise. But you are not doing anything active for the heart, except that you are meditating and reducing your blood pressure and your heart rate. When it comes to exercise, you need something which is aerobic, which increases your heartbeat. So basically, any exercise which increases your heartbeat is the best exercise. So there are exercises like running, walking, jogging, cycling, swimming, these are all exercises where your heartbeat increases. So these are the best exercise for your heart. So whenever you exercise, see to it that your heartbeat increases. You break into a sweat. So walking on a treadmill, walking briskly around your house, these are the best exercise for elderly people. So if you have to do an exercise, see to it that you exercise at least for half an hour every day. If you cannot do it every day, at least for 45 minutes to 1 hour every alternate day, at least twice a week, at least 1 hour thrice a week. That is what is exercise. And as I told you, aerobic exercise is the one which is the best for the heart. Brisk walking supposed to be the best because it has a very good less of chances of injury and very good success rates in maintaining that activity. And you can do it anywhere, even if you are traveling abroad or outside the city, you can still go for a brisk walk. Remember that there is no easy way out to reduce the weight. So do not concentrate on your weight in kgs. What is important is even if you are obese, you don't have to lose weight. What you need to do is you need to exercise regularly, you need to eat well. Automatically you will start losing weight maybe in a couple of months or couple of years, who knows. But what is important is you need to be healthy, you need to be mobile, you need to reduce your risk factors. So even if you are obese, if you are walking every day for half an hour, that's excellent. So what we recommend is do not concentrate on reaching a magic number in your weight, but concentrate on being healthy, being mobile. So go for walks any time of the day is okay. Go for walks, at least walk for half. Brisk walking, try to incorporate, try to go for brisk walking. If you can jog, that's good. Try increasing the amount of jogging, but be very slow on that. Don't go for excessive jogging all of a sudden. The next thing is manage your stress. How do you manage your stress? Stress can be emotional, psychological, physical. Simplify your lifestyle. Try to think of ways by which you can reduce your stress. Think of the triggers. There is a particular activity gives you stress. Try to avoid that activity. Try to think of ways by which you can avoid the stress during that activity. Manage time efficiently. Do not do multitasking. For example, a lot of people do eating when they see TV. They do say a lot of other activities when they are trying to do some other activity. So what is recommended is just concentrate on one activity at a time. Do multitasking. Just simplify your life. Just take time out from work for a few hours to just relax. Maybe listen to a music, do meditation sometimes. Enjoy or invest in a hobby. For example, playing the guitar or singing or something of that sort. So invest in something like arts or craft so that you learn to take a break at least once in a week. Try to keep at least few hours off from your work so that you can leisure around or go for a walk with your family or go for a picnic with your family. If you are in the house, at least meditate 10 to 15 minutes. Here pranayama would definitely help. Meditate at least 10 to 15 minutes in a day so that you cool down and reduce your blood pressure and become calm and relaxed. Smoking, one of the biggest risk factors which we have seen in young kids. In fact, 30s, 20-year-old, we have seen a lot of incidents of smoking, and that is the only risk factor. In fact, extremely harmful. We would not recommend smoking at all. So in fact, if you are a smoker, ask for help. If you cannot quit on your own, ask the doctor whether he can give you any medications which can help you. In fact, there are a very good number of medicines now by which you can stop smoking, and in fact doctors can aid you in preventing smoking. Now what about alcohol? Do not drink excessive alcohol. Okay, now alcohol, we all know some studies are there which I have said that alcohol is good for the heart, but mind you, these studies are done. In fact, red wine is supposed to be good for the heart. That also when it's consumed in 1 to 2 ounce, that is 1 or 2 pegs, so 130 ml or 60 ml in a day. That is red wine, but that is not true for any other form of alcohol, that it comes to liquor, beer, or any other form of alcohol. So in fact, alcohol is nothing but empty calories. So what we would recommend is restrict your amount of alcohol to social events, and even if you drink in a social event, do go only for a single peg or a peg, not more than that. So in fact, if you have a heart problem, we would advise you to avoid it totally. As I told you, benefits of healthy eating, it is very, very important the whole family eats healthy. You cannot have your kids eating healthy when the parents are not eating healthy. So in fact, one should see to it that the kids from their childhood are habituated to eating salads in their dinner, eating lot of fruits and raw vegetables during their meal time or even in the lunch box. See that the lunch box is filled with healthy food items like sandwiches, fruits, veggies. See to it that it's multicolored. Multicolored means that you are eating lot of fruits and vegetables instead of only chips or burgers. Like so, in fact, once in a while outing with the family to restaurant is okay, but then at least in the daily business of eating, at least it's better you stick to the normal ways of eating. Learn to read food labels. If you are buying anything from the market, see to it that you are reading your food label. Items when you go to buy from the market is remember that anything which is high calorie or high carbohydrate is not very good. So stick to items which are made from whole grains. So whole grains are where you have the whole grain preserved. For example, brown bread or anything made from the wheat or cereals which are like oats. These are all whole grain, or even corn. These are all whole grains. So choose items which are made basically from whole grains rather than refined grains like maida. So avoid them if it's refined flour or something, but then always choose items from whole grains. If you are a blood pressure patient, if you have diabetes, if you have heart problems, take medicines regularly. Do not skip your dose. Even if you skip your dose, do not worry about that. You can always take the next dose which is due without worrying so much, as long as you have the risk factors under control. Lot of people ask us whether homeopathy is good, naturopathy is good, Ayurveda is good. Being an allopathic practitioner, I would not like to criticize them, but what I would recommend to the patient is, if you have sugar, and if some doctor says that if your sugar is 400 and he recommends you a particular therapy, you take the therapy. After a month or so, just repeat your sugar and see whether it has come back to the normal range, which is 150 to 200. So that gives us a evident proof that your sugar was high and now it has come under control. So as long as it's going to get treated and the factors are going to come in the normal levels, or blood pressure is going to come to a normal level, sugar is going to come to a normal level, we don't have a problem with that. Not only that, once you have achieved a normal level, every 2 months, 3 months, regularly keep checking whether it is still the same, because after a few months time it may still go up, So always keep regularly testing whether to find out whether you have controlled your risk factor. As I told you, it's never too early to build this. Whatever your age, it's always better to start exercising, going for a healthy lifestyle, and avoiding your risk factors. So I think I would thank you for giving me a patient hearing, and I hope that this webcast was useful for you guys and you incorporate all these advice which I told you in your daily lifestyle. Thank you.